I'm going to show you now how to do a Purpose T screening. So within the patient's record, in the Care Pathways page, and we've got the screening step 1 open. So the first question is mobility status. So you've got 4 options there: walks independently, needs the help of another person to walk, spends all or the majority of time in a patient's bed or chair, and remains in the same position for long periods. Now, you would also go with the option that is the most risk for the patient. So you might have a patient that walks independently, however, spends a considerable amount of time in their chair. So you would pick the second option here, spends all or the majority of time in the bed or the chair. But just to show you all the screening questions, I'm going to click on walks independently. And then for the skin status, you have got different options from normal skin, vulnerable skin, reported history of previous pressure ulcer, a medical device causing pressure ulcer at skin site, and a currently pressure ulcer history of category 1. So again, you'd pick the option that's most at risk for the patient. So if you had a patient with normal skin and vulnerable skin, you would pick vulnerable skin for this patient. If you had a patient with normal skin and a history of pressure ulcers, you'd pick the history of pressure ulcers. But again, just to show you the 3 questions for the screening, we're going to click on normal skin. And then you've got your clinical judgment question. So this is where you look at your patient as a whole and you consider things like patient's medications, what other conditions or treatments they may be undertaking that can significantly impact the patient's skin or pressure ulcer risk. If you're not sure, always tick the top box because it will just take you to the full assessment if needed. But if we click on no problem, we'll see that's the skin assessment completed. However, if we go back to one of the questions and we untick and go back to the skin status, and we then document that they are vulnerable skin or they have an areas of pressure damage, it will take us to the full Purpose T assessment rather than carrying on the screening.